when sitting or pain in your legs, these could be connected to your pelvic floor. I'm going to go over a few questions that will let you see the connection and how so often these get missed. So let's start with, what's causing coccyx pain when sitting? Unless you're sitting on your tailbone on a hard surface, most people's tailbone is not long enough to be sitting on it. That automatically tells me that this person doesn't have a stable pelvis and they're not sitting on the right part of the pelvis. This means the structures that are there to do pelvic stability are not kicking in. So that's the avenue we need to go after, the why behind what's happening. Now, how could leg pain be connected to pelvic floor dysfunction? I've done a video on this already. But if your leg connection to the pelvis is like a leg to the table, imagine the table and then you've got the tabletop. When the legs are not stable, the tabletop is not stable. Tabletop or your pelvis are the same. So that means in case of your pelvis is not stable. That's just a fact and a common sense. When we have pain, we shift our weight, which means we are not balanced anymore. It doesn't matter if this is a minor issue happening right now, but over time, it causes a change in how we move around, and it's only a matter of time that this leads to dysfunction. Most often when we look into this issue, we treat the leg pain and not any other things that are now feeding the leg pain. This means it's only a matter of time before our pelvis and the muscles inside get pulled into this picture. Let me explain. The muscles inside the pelvis work with the muscles outside the pelvis to balance the walls of your pelvis. This is important because your pelvis is the foundation to the structures above, and you are the structure above. Without your trunk, you don't exist. Back to pelvic floor dysfunction, there are a wide range of symptoms. And so when those symptoms show up, you go and see this standard pelvic floor therapist, when then they work primarily by going through the vagina and or anus, trying to relax or make you basically practice squeezing their finger in an attempt to basically change the behavior of the muscles inside your pelvis. But are we addressing the cause? How long is that work going to last? Unfortunately, insurance companies basically chop you into pieces, give each piece to different providers and specialists. So here we are treating a part and not the whole body. We're not addressing the root, but staying busy looking at pain and just a section of the body. Boy, I can talk about this forever. So let's just move to the next thing that shows dysfunctional patterns of movement causing your pain issues. Why is male butt clenching linked to pelvic floor issues? Butt clenching is not a male thing. It happens a lot in men, from what I've seen. It happens for multiple reasons. Most people think of pelvic floor dysfunction issues as incontinence, sexual dysfunction, pelvic pains, things like that, but that's not it. That's not the complete list. You can have pain in your lower back, sacroiliac joint, lower truncator issues. You can have chronic pain in those areas, poor posture. These are all different indications of pelvic floor dysfunction as well. Now, going back to butt clenching should not happen unless you voluntarily decide to clench your butt. When you clench your butt, when you're walking, or when you clench your butt to lift, you're having dysfunctional pattern of movement. And just like any other type of dysfunctional patterns of movement, you'll end up with issues down the road. When a person clenches the butt with walking, that means this person doesn't use the hip flexors with all the other hip stabilizers to move the leg forward. They're basically shoving the pelvis forward instead of flowing the pelvis forward. This over time causes issues with leg performance, glute performance, back performance, and overall movement performance. In men, I see their workout technique and also frequency of, believe it or not, masturbation interfering with their pelvic movement and stability. When I evaluate their gait, the way they walk, the way they move, I see a lot of butt clenching with movements that basically don't require the lower glute activation. Bottom line is that we need to look at pain differently because there are a lot of dysfunction happening before the point of pain, and it's easy to make the pain go away using medication, but we all know medicine does not address the cause of the issue. More than anything, this creates a bigger time gap before the right treatment is actually approached. The chances of recovery goes down as time passes on. With how much we've been talking about pelvis and men, now let's talk about how can you start building pelvic floor strength as a man. Well, building pelvic floor strength as a man is no different than any other gender. To build strength, we first need to start breathing correctly, breathing biologically, which I've done so many times. I've done videos on, and I will make sure to post it at the end of this video. This is when you breathe in and out through your nose. You send the abdominal diaphragm towards your pelvis, and basically you try to push the sides out. Your spine is nice and neutral. Now you breathe in, pushing your sides out. You want to place your hands on the side of your body, and as you breathe, don't let the chest rise. Instead, let the sides go outward. This allows the muscles inside of the pelvis to relax when you breathe in, and these same muscles practice working together in a beautiful fashion, contracting to breathe out. The next thing you want to do is to make sure that the spine is nice and strong. Why? Because the spine is attached to the pelvis, and if it's not stable, it will make your pelvis unstable. Let me explain. Your spine is being supported by the muscles in the back and by the inner abdominal pressure coming from your biological breathing. That's why biological breathing is so important. And when we practice keeping the spine neutral, we're practicing the back and the front of the body working together to stabilize the spine. Going to the leg attachment of the pelvis as a potential culprit for instability of the pelvis, we need to look at assessments that show if the butt and legs know how to do the job of the butt and legs. We want to see how the rest of the body does as the legs and butt are performing their job and being challenged. This part of my exam really shows me how dysfunctional the pelvis and the whole body of the patient I'm working and I'm dealing with is, or are, I should say. The fix is always developmental exercises, in my opinion, which we know by studying human babies. After all, we all start from helpless infants, go to the running toddler stage without any weights, bands, gyms, or guidance, which means we're hardwired to move a certain way. So we bring that certain way into the picture, which is innate to our body. So the body parts know exactly what they need to do when we put them in that right environment. Hope this all made sense to you. Please make sure you subscribe to the channel, which is packed with the right exercises and the right pieces of information to get you understand the importance of finding the why behind the issue and to increase your batting average and having a long-lasting effect with the type of exercises that you are innately familiar with. Use one of the methods of contact in my description box to contact me if you have any questions. And until next time, take care.